All right, let's dive right in. You've had cataract surgery, and there's really only one thing on your mind, isn't there? When can I get back behind the wheel? Well, the answer is a little more complicated than you might think. It's not just about your eyes, it's about your brain, your wallet, and your safety. So let's break it all down.
Okay, first things first. Let's tackle the big one. The question that's on everybody's mind. Yep, there it is. When can I drive again? And look, I get it. It feels like a simple question that should have a simple answer, but it's not really about the clock. It's about this incredible, kind of weird process happening inside your brain. A process where it's literally learning how to see the world all over again.
So here's the deal. Your doctor might give you the official guideline, right? Maybe 24, maybe 72 hours. And you think, great, I'm good to go. But then there's reality, and reality can feel a lot different. We're talking about serious glare from headlights, totally weird depth perception, and this feeling that your brain is just lagging a little behind your eyes.
So let's get one thing absolutely crystal clear. The day at the surgery, forget about it. The first 24 hours are a hard and fast, non-negotiable, no drive zone. I mean, think about it. You're still dealing with the anesthesia, your vision is blurry, you've got this big old shield on your eye. Getting behind the wheel isn't just a bad idea, it's a really, really bad idea that could mess with your insurance, your license, everything.
All right, so you've survived that first 24 hours. You're resting up. Now we get to the really fascinating part. What in the world is going on inside your head as it tries to make sense of these brand new eyes?
I love this quote from a patient because it just nails the feeling. It's like someone polished half my brain and left the other half in the attic. That's especially true if you've only had one eye done so far. Your brain is getting these two totally different signals. One is like crystal clear 4K, and the other is, well, it's the old foggy channel. And your brain's job is to somehow stitch those two views together into one picture. It's working overtime for sure.
And this is what that hard work feels like when you're looking at the world. Suddenly everything is so bright. Colors are popping like you've never seen them before. You might see these halos or starbursts around lights at night. And yeah, it can feel a little weird, a little disorienting. But here's the key takeaway. This isn't a sign something went wrong. This is the sign that your brain is doing its job. It's adapting.
This whole thing has a name, and it's called brain recalibration. Here's the best way to think about it. You just gave your eye a brand new top-of-the-line camera lens. It's incredible! But your brain, which is like the computer running the camera, is still using the old software. It needs a minute to update. And during that update, things like depth, distance, and judging speed can get a little wonky. The good news? That software update happens automatically, and it gets better literally every single day. Okay, let's shift gears for a second. We've talked about your eyes, we've talked about your brain. Now let's talk about something that can hurt just as much if you're not careful, your wallet. Because jumping the gun on driving has some very real and very expensive risks.
Let's just start with the immediate hit. A tiny misjudgment. Maybe you clip a curb or tap the car in front of you at a stoplight, and boom, you're instantly out your deductible. That's $500, maybe more, gone in a flash. It's a pretty expensive trip to the pharmacy, right?
Oh, but it doesn't stop there. No. That fender bender is the gift that keeps on giving, in the worst way possible. Because after you pay that deductible, you can bet your insurance premium is going to go up. We're talking $150 to maybe $600 extra per year for the next 3 to 5 years. Do the math on that. That one impatient drive ends up costing you for a long, long time.
So let's just lay it all out side by side. The money math is pretty simple. On one side, you have the cost of a week of ride shares or asking a friend for a lift, maybe a couple $100 tops. On the other side, a potential multi-$1,000 mistake between the deductible and the premium hikes. When you look at it like that, waiting isn't just the safe choice, it's the financially smart choice. The smart money is absolutely on being patient.
So we know the risks, we know what's happening in your brain, so how do you actually handle this tricky first week? Let's get practical. Here is your step-by-step playbook.
Okay, here's the game plan day by day. Days 0 and 1, you're on the bench. No driving. Period. Then, after your post-op checkup, and only if your doctor gives you the green light, you can try what I call micro drives. We're talking 5 minutes, around the block, no traffic, no pressure. Then, from day 4 on, you can start to gradually expand your routes. But notice what's still off the table? Night driving. We'll save that for last. And for those first few times you get back in the driver's seat, remember these 3 simple rules. 1. Plan the most boring routes you can think of. Quiet streets, daytime, good weather. 2. If you feel even a little bit overwhelmed or weird, just pull over. It's fine. And 3. Treat this like practice, not a test. You're not trying to prove anything. The goal here is a completely, totally, utterly uneventful trip.
All right, let's wrap up with the mental side of things, because this really isn't about courage or toughing it out. It's about being smart and building genuine, real confidence.
Look, it's so easy to feel impatient, to feel like you're losing your independence and you just want to get back to normal. But listen to this. You are not weak for taking this seriously. You are responsible. You just had surgery on one of the most precious things you have, your eyes. Being cautious doesn't mean you're scared. It means you respect the healing process, and you're being responsible not just for you, but for everybody else out there on the road.
And now for the final boss battle, night driving. Do not, and I repeat, do not even attempt this until that daytime glare and those halos have gotten way, way better. Your absolute best friend for night driving is a spotlessly clean windshield, inside and out. Any smudge or streak is going to catch the light and make things 1,000 times worse. And when you do go, start small. A short 5-minute trip on a familiar road on a clear night. You'll get there.
So, when it all comes down to it, it's pretty simple. Your car keys, they're not going anywhere. They'll be right there waiting for you tomorrow and the next day. The real question you have to ask yourself is this: are your eyes, your license, and your wallet truly ready today? Just be patient, be smart, and pretty soon you'll be back on the road, driving with more confidence and seeing the world more clearly than you have in years.